A warm good afternoon to everyone. Today, our second session of the webinar will mainly focus on the subject RACHANA SHAREERA on behalf of Sharada Ayurveda Medical College and Hospital, Talapadi, Mangalore. And we are glad to have our expert speakers who will be interacting with you shortly. Welcoming Dr. Muralidhar Badigar, Dr. Ranjit R. Warrior, and Dr. Manu Krishnan K to the webinar on behalf of Sharada Ayurveda Medical College, Talapadi, Mangalore. For the first session, we welcome our guest speaker, Dr. Muralidhar Badigar, Principal and Professor, MRN Ayurvedic Medical College, Bagalkot. Sir has completed his BAMS and MD and PhD in RACHANA SHAREERA. Sir has teaching experience of more than 12 years. And overall, Sir has dissected 80 plus cadavers in different colleges of Karnataka till now. So, let's welcome Sir to take over the session. Over to you, Sir.
Hello, good afternoon, everyone. Okay, my voice is clear or not, sir? Hello. Hello, Manu Krishna, sir. Hello, sir. ಇಕೋ ಆಗ್ತಾ ಇದೆ ಅಲ್ರಿ ನಾನು ಮಾತಾಡೋದು ಕೇಳಿಸ್ತಾ ಇದೆಯಲ್ಲ ಆದ್ರೆ ನೀವು ಕೇಳ್ತಾ ಇದೆ ಇಲ್ವ ಅಂತ ನನಗೆ ಗೊತ್ತಾಗಲ್ಲ. ಓಕೆ. Yeah. Okay. I'll switch off the mobile. Okay.
Sir, you are audible. You can continue. Sir, you are audible. You
Hello.
can continue. Sir, you are audible. You
Now I
can
am
continue,
audible,
sir.
na?
Yes, sir.
Yes, sir, you are audible.
Okay. Now my voice is clear, na?
Sir, can you please share the screen? PPT. Sir,
Hello.
sir, can you please share the PPT once?
Okay.
Share the screen.
Just now screen is shared, na?
Ah, yes, sir.
Yes, sir. It's visible.
Okay, sir.
Hello. Any problem with echo?
No, sir. We can see your slides. It's working fine. You can continue, sir.
Okay. Okay. Good afternoon to one and all. So today we are in the webinar of examination section. So actually as a teachers we are giving the importance to the teaching methods. So the students are going to learn throughout the year, but we are installing the so many programs to the students' mind by teaching, but no one teacher is concentrating towards the students regarding the examination. How the students are going to perform in the examination, and how to write in the examination, and how to present the answers in the examination. But here Sharda Ayurvedic Medical College made a great platform for the students who have going for the who have appearing for the examination, especially for the first year students. So this is a great platform given by Sharda Ayurvedic Medical College to the students all over India and all over Karnataka. So all this step in the name of the step. So all the students should take this utilization properly, and write their exams and make the futures better. So myself, Dr. Muledhar Badigar, presently I am working as a principal MRN Ayurvedic Medical College, Bagalkot. So this is a program step. The name itself, it's very nice. The study techniques and exam preparations. So the study techniques, different techniques should be adopted for the different subject. In this point, I am going to cover the steps for Rachana Sharira. So in this point, in this presentations, I am going to cover introduction and smart work and the hard work, and Rachana examination preparation, and writing skills in the examinations, and practical examination, how to prepare for the practical exam, and how to face the Viva examination. First, introduction. So the word exam itself is the creating a sort of phobia in the student's mind. Still today, still today, we are also having a little bit phobia when we are going to appear for the exam. Even though just before one day, though I completed my PhD, before one day of the PhD examination, I have also come across this problem. So it means from first standard till today we are writing the exams. Still, this phobia is not completely abolished from our mind. So this type of the programs helps the exam phobia converted into exam philic. The students love the exam. So here one quotation, you get what you focus on. So focus on what you want. So whatever we are need in our life, we should focus on that. We need the rank, focus on that. Definitely you will get it. So Rachana, Share Rachana paper, which includes the two papers. One is a Share Rachana first, Share Rachana 2. Share Rachana first paper, it includes the 100 marks, and Share Rachana 2, it includes the 100 marks. It means the theory paper, total it carries the 200 marks. The Share Rachana paper 1 is further divided into part A and part B, and each part or each section carries the 50 mark. Part A 50 marks, part B 50 marks. Actually, part A, it is a point we should concentrate. As per our syllabus, the complete Ayurvedic points are given here. Complete Ayurvedic points. So if you are prepared, if you have studied all the Ayurvedic points, then 50 marks in your hand. And remaining a part B, which includes the different type of the modern concept like osteology, myology, angiology, and remaining points are here, embryology, like that. So if you are, it's very difficult to concentrate for 50 mark part B. But as a student, if you are prepared well for 50 marks Ayurvedic part, so 50 marks in your hand. So maybe actually when compared to the Rachana paper 2, the Rachana paper is little bit tough for the students. It is a tough means not because of the tough material is there in this first paper. It's not like that. Syllabus is too much vast. On which topic the student should cover, it's very difficult. But my suggestion, concentrate on part A, because complete Ayurvedic points if you are covered, you will get the 50 marks. And remaining part B, so if you are just gone through the bird's eye view, then also you'll get the marks in the part B. And Rachana 2 paper is also very easy because it consists the complete modern part A and part B, and syllabus is also limited. So systems are given: respiratory system, digestive system, sense organs, and nervous system. Though for the study purpose, the students have a clear-cut demarcation to where to concentrate. So because of that reason, for that point of view, the Rachana paper is little bit easy. And come to the point, practical exam. The practical exam consists of two parts. One is a written exam, another one is the viva. The written exam, which includes the 90 marks plus 10 marks, there will be practical record. It means the written carries the 100 marks and viva carries the 50 marks. So here the written and viva together is carries the 150 marks, and theory paper carries the 200 marks. The total Rachana paper is about 350 marks. Come to the point, we come to know that marks distribution regarding the paper wise. Next, we are going to discuss about how to work for the Shareera Rachana paper, how to prepare. So whatever the program it may be, whatever the subject it may be, it's not only limited to the Shareera Rachana, it's other subject also. So the two types of the work, one is hard work, another one is smart work. Hard work means it is more stressful, more time consuming, and it needs more effort. The smart work is less stress, less time, and less effort. But results both are same. Then both results are same. Then why should we work hard work? Why should we go for the hard work? Oh, we are planning for the smart work only. It's not like that, because the smart work is the creamy layer of the hard work. So when you are first adopting the hard work, then you come to know that what are the technical problems, then automatically the hard work is converted into smart work. So smart work is not converted into hard work, but anything we starts with the hard work. The example, I am not going to explain this example. All of you know this picture, old crow and modern crow. To get the water, this crow is putting the stones inside that, water will come up, water level is going to come up and it's going to drink. It's a old method. This is a hard work. But a smart work is using the straw to drink the water from that particular part. So the thing is, the drinking the water is the main aim, but methods are different. So similarly, hard work or it may be the smart work, the ultimate aim is to get the marks more in the exam. So starts with the hard work. When you started the hard work, you come to know that the technical problems, what are the problems. Then after the identification of the problems, the convert the hard work into the smart work. How to convert hard work into the smart work? Just I'm going one example. So here, hard work plus smart work together, it gives the success to the life or success for in the examination. For example, brachial plexus. First, you are going to start with the hard work. Read in the textbook along with the diagram. So you come to know that what are the difficulties to remember this brachial plexus. Now all of you are observing this brachial plexus, but see how much it is complicated, how the different names are given, and the brachial plexus is formed by the root, trunk, division, and chords. The roots are formed by C5, C6, C7, and C8 and T1, and roots are united going to form the trunk. The trunks after that they are divisions. The divisions are end up with the chords. Chords are end up with the branches. So now you have studied this brachial plexus with BD Chaurasia or any other textbook. The problem is going to arise. What are the problems now? So this complex picture, how to remember this complex picture, and how to label these points, how to remember all these things. Then now mind is start to work on this. Then mind is working on this and convert this hard program into the soft program like this. See, this diagram is totally difficult. This diagram is totally difficult to remember. But what I made, I understood the brachial plexus phenomena, how it is going to form. Just I converted this method in this picture. See, the brachial plexus is formed by C5 root, C6 root, C7, C8, and T1. It means 5 roots are there. So this C5 and C6 together forms the upper trunk, and C7 forms the middle trunk, C8 and T1 going to form the lower trunk. But each trunk is divided into anterior division and the posterior division. Anterior division, posterior division, anterior division, posterior division. Then identify all the posterior divisions. 1, 2, 3. Join all the posterior divisions. Then it's going to form the posterior chord. Then join the anterior division of upper trunk and anterior division of middle trunk. It's going to form the lateral chord. And anterior division of the lower trunk itself is continuing as a middle trunk. So it means roots, 5 roots are converted into 3 trunks. 3 trunks are further divided into anterior and posterior division. It means 6 divisions. And all these 6 divisions are permuted and combined in such a way that they are going to form the 3 chords. So this pattern should be remembered by using the mnemonics RTDCB, root, trunk, division, and chords and branches. How to remember this one? It's very easy. Root, real thinker drinks cold Bormita. So if you remember this mnemonics, then it's very easy to frame this diagram. And lateral chord has a branch, that is LML, lateral pectoral nerve, medial pectoral nerve, and lateral root of median nerve. And similarly, the medial chord, that is a M for U, means in the name of M, the 4 branches are there, and U for ulnar nerve. And last posterior chord gives the branches. This is the ulnar, that is upper subscapular, lower subscapular nerve, nerve to latissimus dorsi, axillary nerve, and the radial nerve. So like this, the hard work should be converted into smart work. Within less time, you can remember this diagram for the long time. Another one example for the Garbha Sharira. So all of you know the Garbha Sharira, Masanu Masika Garbha Uruddhi. This question was repeatedly asked in the exam. So when the Masanamashika Garbhavruti is asked, the students are facing the problem how to remember all this 9 month development. The Pratame Mase Kalalam Jayate, Dvitiye Ghanam. So like that the sloka is going. But the students are facing the problem to write in the exams. For that purpose, convert this hard work into the smart work by making a single word. In the first month development, the mass is Kalalavastha. In second month, it is a Ghanam. In third month, it is converted into 5 buds, that is called Panchapindikam. In fourth month, it is a Sarva Anga Pratyanga Pravakto Bhavati. It means all the Anga Pratyangas are formed in the micro form. In fifth month, Manas is formed. In sixth month, Buddhi is formed. In seventh month is nothing but the fourth month only. But in fourth month, all the organs are formed in micro level. But in seventh month, macro level. In eighth month, Asthira Ojasaha. In the ninth month, Prasavaha. So one word, if you are remembered, then you can write these words in the exams very easily with elaboration. So try to make the hard concept into smart concept, and this smart concept can remember for a long time in your mind. See, Pratame Mase Kalalam, Dvitiye Mase Ghanam, Tritiye Mase Panchapindikam, Chaturte Mase Sarva Anga Pratyanga Prayakto Bhavati, Panchame Manaha, Sastame Buddhihi, Saptame Sarva Anga Pratyanga Pravyakto Taraha, Ashtama Asthira Ojaha, Navame Prasavaha. So, if you know this concept, then you can elaborate very easily in the exams. Just I am giving some tips for the exam preparation here. So first we should study the plan schedule properly, and properly how to schedule the study plan, make the timetable, because you have the other subject also. Particularly allot the time for the Rachana Sharira subject. So preferably it is at the night, because when you are sleepy at that time, select the Rachana Sharira, because it is a few diagrams are there. You can practice the diagrams. So at that time you can give the preference for the study for this Sharira Rachana. And some of the students are planning only throughout the year. They are planning, they are preparing the timetable, everything, but throughout the year they are preparing only. But start the study as early as possible. Simply, if you have studied the material, it's no use. Use the creative ideas like a model chart and prepare the charts, and keep this chart in front of your table every day you are seeing. Then it's very easy to remember. And after that, you can take the clear notes. So I am giving the hint to all the students: make one page notes. This is very important. For example, liver, name of the organ, liver, location, organ, whatever it may be, within one page you should complete. Don't write is was. For example, liver is located in, not necessary. Location, location, in front of the location, right hypochondric region, epigastric region, and little bit occupies the left hypochondric region. Just write the words. In exams, you can write is, was, it was located like that, is mostly located like that. But when you are preparing the notes, don't write as it is in the textbook what they are given in your notebook. Prepare one page notes for one organ, one page, for one bone, one page. Otherwise, prepare the flashcards. The flashcards are nothing but a short notes on the particular organ. Instead of flashcards, why suggesting you, the students, to prepare the one page notes. After preparation of the notes and everything, if you have studied, it's not over. Then there is a problem with the memory. So how to keep in the memory? Do the repetition, repetition, repetition. So once repeatedly, if you are studied, then understand the subject properly. Then after understanding the subject properly, to keep in the mind, so what you should do, use the memorization tracks like mnemonics. For example, to remember the carpal bones, she looks too petty, try to catch her. Scaphoid, lunate, triquetrial, fusiform, like that. So if you want to remember the things, use your own tricks. So similarly, group discussions. The group discussion, when you are going to complete your study, then explain to others, then This is going to increase your memory power. And also, if you are discussing with your seniors, then ask the questions to them. They are going to answer. That is also enhance your memory. Then after the group discussion, then self motivation. When you are going to study at that time, we need the motivation. So self motivation means how to get the self motivation. So to get the self motivation, we should imagine. So now I am studying the Share Rachana. If I got the more marks, if I scored more, if I stood for the first rank in the university, like that, you should imagine. So what is our position after this completion of the study? Then you will get the motivation. And last one is quiz or screen yourself. When you are sleeping, for example, throughout the day you have studied the anatomy, before going to sleep, just imagine what you have studied today. For example, if you have studied the bone humerus, screen, just close your eyes and screen the humerus, what are the parts, where it is located, then it's very easy to remember the things. And also focus on your weak points, because some of the weak points we are also having repeatedly, we are using the mobiles and unnecessary we are wasting the times. So at that time focus on particularly our weak points and convert that weak points into strong points. Use the resource like books, YouTube, and many data is available in the YouTube. And if the subjects are complicated, use the YouTube channels, and you convert that difficulties into the simple one. And keep the body and mind healthy by doing the yoga and taking the healthy foods. And don't compare with others. Solve the previous year question papers. And Sharda Ayurvedic Medical College Mangalore made question banks. So any subject it's related to the Rachana or Kriya or whatever it may be, collect the question paper and solve it. Now you have prepared. Now you have prepared the complete. Your gun is loaded with the knowledge. You are loaded with the complete knowledge. You have prepared according to that. Imagine, then a loaded gun should be fired properly. Otherwise, if it is a misfired, then whatever you are done the work, that's become totally waste. For that purpose, we need presentation skill in the examination. First, when you receive the question paper in your hand, the questions and answers should be written properly, because question number and answers number should be matched. For example, question number 12 is the heart, then your answer number 12 should be the heart. So if you are written complete answer of the heart, but if you are missed the number, instead of writing 12, if you are written the 13, then you are going to lose the marks. Because of that reason, questions and answer number should be written properly in the answer sheets. And some of the students are studied more regarding some organs. Because of that reason, they are writing more. But even though it carrying the 3 marks, don't do like that. Maintain a proper time management, and read the questions with carefully, and main headings and side headings. So you put the main headings and side headings properly in the answer sheets. And only writing, simply writing the things is not useful. So use the appropriate diagrams and use the flow charts during the presentations. And sloka should be written in Devanagari Lipi. So this is going to helpful for the scoring more in the exams. And how to write in the exams. For example, if any organ is given to write, then write like this. You just follow this pattern. First, you should write the introduction. Next, for example, liver. So it is one of the largest gland in the body, like that. Then you should write the location where it is exactly situated. It may be kidney, or it may be liver, or whatever it may be. We should write the particular word, so where it is located. For example, heart. Heart is located in the middle media sternum. So next, after that, you should clarify number of the organs. So if the liver is there, then it's the only one. If the kidneys are there, two in number, like that, should write the number. Then type of the organ is a endocrine gland or exocrine gland or it's a simple gland. So you should mention the type of the organ. After that, you should write the dimensions. Dimensions means breadth, length, and it's if it is there, it's a volume or it may be weight, whatever it may be. After that, draw a neat label diagram of the particular organ with the anterior view and the posterior view. And next, label the parts. While writing the parts of the organs, don't write continuously. Use the flow charts. For example, liver. Liver consists of 5 surfaces. Just write the 5 surfaces. Then one border. Then write the name of the surfaces. Write the name of the borders with using the flow charts. And next, liver is made up of with the lobes. It consists the right lobe and left lobe. Then right lobe and the left lobe. Right lobe is further divided into quadrate lobe and the quadrate lobe. So like this, just put the charts. Then the valuators also become very happy by seeing your presentation instead of in the writing in the form of sentence. And after that, write the little bit histology, not in detail. Just for example, liver hexagonal arrangement. Just write 1 2 words and the name of the cells present particularly in the particular organ. Then you should write about the blood supply, venous drainage, lymphatic drainage, and nerve supply. And your answer must and should end with the applied anatomy. Any organ, it may be any organ. So you just follow this pattern. Just apart from that, if there is any bone was asked, so then write the introduction regarding the bone. Then you should write the location. For example, humerus. Humerus is located in the arm region. Extension, it is extended from the shoulder joint to the elbow joint. Humerus 2 in number. And type, according to Ayurveda, it is Nalakasti. According to modern science, it is a long bone. Like that, you should write. And after that, you should write the diagrams, at least anterior view and the posterior view. First label it, and after that, anterior view muscle attachment and posterior view muscle attachment and label it. And write the parts. While writing the parts, don't write in detail with the sentence. Better, for example, humerus is divided into 3 parts: upper end, lower end, and the shaft. Write the parts in the upper end, whatever the it may be greater tubercle, lesser tubercle, head, neck, surgical neck, like that. You just write, mention the name of the parts with the flow charts. If you have the time, then you explain it. After that, you should start with the site determination and the sex determination. And if it is possible, you should write the ossification also. And the answer should be end with the applied anatomy. This is a pattern for the bone. If it is any joint is asked in the exam, first name of the joint. For example, you can say hip joint or shoulder joint. Then location. If it is a shoulder joint, it is the upper limb joint. Location, it is located in the upper limb. Number 2 in number. Articulations. Articulations, here we should write the shoulder joint is formed by the head of the humerus and glenoid cavity of the scapula. Like that, you should mention the articulations. After the articulations, you should mention the name of the ligaments. After that, we should write the diagram and write the movements involved in that particular joint. It may be flexion or it may be extension, whatever it may be. Then artery supply, venous drainage, nerve supply, and the applied anatomy. This pattern should be followed in the joint section. And if any muscle is asked, then write little bit 1 or 2 the introduction point. Next, location. For example, gluteus maximus, it is present in the lower limb, and it may be deltoid, it is present in the upper limb. And write the origin point. If you not remember the origin point, just write the proximal attachment and insertion. There is a distal attachment. For example, deltoid. Deltoid is originating clavicular fibers, acromion fibers, and spinous fibers, and all are going to attached or inserted into the deltoid tuberosity of the humerus. And next, you should write the nerve supply. That is the action of this particular muscle and speciality of the muscle, and draw a diagram if it is possible, or the speciality, or you can write the applied anatomy related to this particular muscle. If any vessels is asked in the exam, should write starting point, where it is going to start, where it is going to end, and course, and write the branches, what are the branches, and is there any specialty or applied anatomy related to that, and draw the diagram. For example, axillary artery starts from outer border of the first rib and ends with the teres major muscle, and these are the first part gives the one branch, second part gives two branches, third part gives the three branches. So like that you can write the branches also. This is a pattern followed, should be followed for the artery. So it is the for the modern anatomy point of view. And if there is any questions regarding Ayurvedic point of view, the students are facing the problem regarding how to remember sloka and other things. And some of the students are having the sloka phobia, means they hate the sloka. But first, I am requesting to you people to memorize the sloka. That is a better thing. If it is not possible by the students, then do one thing: split the sloka, use the terms, whatever the terms are there in the Sanskrit language, as it is, you can copy. For example, if the question is Mruta Samshodhana, you are not memorized the particular sloka, Samastagatram, Avishophatam, like that. So then what you should do, you split that one. Samastagatram, Avishopahatam, Na Adirga Vyadi Piditam, Avarsha Shatakam, Apurusham. So this is the selection criteria for the body selection. Samasta Gatram means the complete body should be selected. The body should not die due to the poisoning, and the body should not die due to the chronic diseases like AIDS and viral disorders like corona. And the body should not cross the 100 years, and male body should be selected for the dissection purpose. So if you are written the sloka, it is well and good. If you are not memorize the sloka, then at least follow this pattern to write in the exam. Then come to the point, question paper. So many students are loaded with the phobia or tension. So it's only for 100 marks. Don't worry. One paper is carrying the 100 marks. So most of the times what we are thinking, we are preparing for the 1000 marks or 10,000 marks, even though, because we have prepared everything, but the question paper is only 100 marks. Use your time sense and use the knowledge and write appropriately. So 10 mark questions are 20 marks, 5 mark questions are 10, 50 marks, and 3 marks questions are 30 marks. In this pattern, as per my knowledge, in the RGHS pattern, it's a difficult task to fail in this exam. If you want to fail in the exam, you should do your own effort. To pass need not necessary to any effort, because out of 30, 3 marks questions are there. No, out of 30, so we can get minimum 20 mark. It's a difficult task. No, it's not a difficult task. Easily you'll get the 20 mark out of 30 if you are written appropriately. And out of 50, if you get the 20 mark, out of 20, if you get the 10 mark, then total score is 50. Then there is a passing. The passing is very easy, but scoring is little bit difficult. So if you want to score whatever pattern I told, so just follow the pattern and you will get the maximum marks. You will get the maximum marks in this section. So who have afraid the exam, just think for passing like this. Already you have prepared lot of things and then plan to get the maximum marks. To get the maximum marks, plan accordingly what I told. And marks and answers. So maximum 6 points with the diagram for 3 mark questions. For example, students are writing more for 3 marks, writing less for 5 marks. So don't do like that. Maximum 6 points. So minimum 6 points with the diagram for 3 marks question, and for 10 or 5 mark questions, you should write the same answers. But for 5 marks, without is was. For 10 marks, with is was. For example, so liver location, right hypochondric, epigastric, left hypochondric. This is the answer for 5 marks. For 10 marks, the liver is located in, like that you can start. So there is no much difference. But for 5 marks or also 10 marks, concentrate on the diagrams. And don't calculate number of pages, how many pages I written, because quality is more important than the quantity. See here, one of our students doing this one. It's a wonderful concept. One page notes. What I given the suggestion. Anything. It's a ureter. So ureter, where it starts, where it ends. What is this tube? What is the length of the ureter? And what are the relations? What is the artery supply? And they will simultaneously they use the internet and they'll copy and paste here. And they are preparing the notes with the diagrams. And also they are also preparing the diagrams here. Though by using this technology, you can remember. See, ureter means one page, liver means one page. So by the diagrams, if you have the diagrams, then these diagrams gives the maximum knowledge to you people. So like this, prepare the one page notes. This is another view. For example, here is the great Stephanus vein. This is a short Stephanus vein. So instead of writing so many pages, so practice like this. See, great Stephanus vein starts from the medial malleolus, ascending upwards, and it's go to posterior to the popliteal fossa, and coming medial, anterior medial aspect of the thigh region, and finally entering into the Stephanus opening and joins with the femoral vein. So here, if you know this diagram, then you can write pages together. This is similarly about the short Stephanus vein. So what I'm requesting to the students, make like this one page notes. So one page notes are flashcards. So before the one day examination, if you've seen this picture, you will recollect all the information. So if you want this one page notes, just go through this Facebook page, High on Medicine. You will get anatomy related one page notes. So you can download and follow and go through these notes. And another, there is a release anatomy. So this YouTube is there and Facebook is there and in the Instagram so available. So one page notes are available, and in YouTube you will get some anatomical detail explanation regarding the sense organs and other things. Then utilize these things. And one more, I am very happy to introduce these two fellows, the students, Basavaraj and Chetan. Presently, they are working in the final year, presently studying in the final year, but still today, they are fans of anatomy. So they are preparing all these one page notes, even though there is no use for them, but still today they are preparing the notes and uploading to this three-lease anatomy. There is a Moorlees anatomy pages, and they are doing the hard work. There is they have a craze regarding the anatomy, even though in the final year they are not ready to leave this anatomy. So because anatomy is such a addiction, if you are addicted for the anatomy, even though there is no exam, the students are working. The best example, Mr. Basavaraj and Chetan, final year students. And come to the point, practical exams. In the practical exams, the written pattern will be there. So here, need not worry about the detailed explanation. Just remember name. It may be organ name or it may be bone name. So usually they are going to keep the 10 bones and 10 organs, or a single bone or single organ. It depends upon the college. So usual pattern is 10 bones. They are going to keep the 10 organs. Don't afraid if they kept the 10 bones or 10 organs, because they are not asking to you to write detail. They are going to ask a few points regarding that. You can manage very easily. And there will be one question from Marma. It may be Sadhya Pranara Marma, whatever it may be. It's the one long question. And apart from that, they are going to ask the one question from the fossa. It may be femoral triangle, or it may be popliteal fossa, axilla, or cubital fossa, like that. And apart from that, there will be one more question. That's the radiological anatomy or surface anatomy. Maybe they are going to keep on X-ray. Then they are going to ask, identify this X-ray. That's all. And Viva should be prepared under the two headings. One is the Ayurvedic points and another one is the modern points. So prepare this textbooks are available, YY in anatomy. So just go through them, then you will get the idea. And maybe the questions after this, the students are asking, sir, what are the important questions in the exam? So for that, I'm asking the question to you: which part of your body is important for you? If you are thinking brain is important, if you are thinking eye is important, if you are thinking tongue is important, so which parts you are feeling important, all are the important questions in the exams. If your eye is not important for you, then leave it, no problem. So the organs all are the important. The student should prepare all the organs and all the bones and all the fossas particularly, because human body, you are playing with the human body after completion of your examination. So give equal importance to each and every corner of the human body. So there is no shortcut for the success. So if you want to get the success, just practice whatever I given the tricks for you, then you will get the success. And I am wishing you all the best or good luck for your examination. And use these tips whatever I given. So prepare the flash notes, or you can prepare the one page notes, and you will get the success in the exam. In this occasion, I am convey my sincere thanks, because it's a great platform given for me. So this is a great. I'm in this occasion. I'm going to convey my sincere thanks to Dr. Ravi Ganesh, Principal, Sharda Ayurvedic Medical College, Mangaluru, and Dr. Amrita Ravi Ganesh. And I'm very thankful to Dr. Ranjit Sir, HOD, Department of Rachana. And I'm very thankful to Dr. Manu Krishna. Actually, is a backbone of this program, and is doing, and I really appreciate him. So is whatever this programs is conducting in the form of step or question bank. Really, this work is appreciable, and this credit goes to Manu Krishna and also team. And also, I'm congratulate all the Sharada Ayurvedic Medical College team for this doing the work, and conveying easy techniques to the students community. So thank you one and all. And I'm conveying my sincere thanks to all my dear students who have heard with the patience and utilize these techniques and get success in your examinations. Thank you one and all.
Thank you, Dr. Muralidhar Baligar, for helping us prepare better for our written and Viva exams, and also for taking time from your busy schedule to be here as our guest speaker at our webinar. Your presence and wise words helped us in many great ways. Thank you, sir. Introducing our next speaker, Dr. Ranjit Avariyar, presently working as HOD and Associate Professor in the Department of RACHANA SHAREERA at Sharada Ayurveda Medical College and Hospital, Tallapadi, Mangalore.
Sir completed his BAMS education from Sri Jayendra Saraswati Ayurveda Medical College and Hospital, Chennai, and MS-IU in Shalli Dandra from Ayurveda Mahavidyalaya, Hubli. Sir has published articles for postgraduate scientific magazine Ayurveda Mahavidyalaya Hubli, and also about the role of Kasisadi Kaila in the management of Bagandara in International Journal Ayurveda 2014. Sir has given oral presentation done on efficacy of Apangamanna Sharleba in Asia at the International Seminar Global Ayurveda Festival 2014. Let's welcome Dr. Ranjit sir to take over the session. Over to you, sir.
Thank you. Is it audible? Audible?
Yes, sir. Yes, sir. We can hear you.
Audible?
Yes,
Yes.
sir.
Okay, yeah, fine. Good afternoon, all. In this section, I will be explaining about the various study techniques that you can utilize for your anatomy exam preparation. Okay, so we'll start the section. Wait a second. Yeah, okay. The structure of our body, that is a human body, which approximately measures about 160 to 170 centimeter in length, 35 to 40 centimeters in width, which consists of about 11 body systems, 78 internal organs, and around 30 trillions of cells. Before learning the structure of this body, you should remember one thing, that in just 1 or 1.5 year, you can't finish learning this subject, and you can't be perfect in that. That's why we have 3 years of master degrees, not only in case of anatomy, in case of all subjects. And a doctor's life is like a continuous process of learning. After your studies, when you become a practitioner or a teacher or both, you will gain knowledge from your patients and students than what you have studied for passing the examinations, right? So, as a first year student, no need to worry that I am not perfect in anatomy. Because if you take a single system, for example, neuroanatomy, that itself need more than 1 year to complete the total nervous system. So your prime responsibility is to earn the basic knowledge about the human body. That is the foundation of your upcoming growth as a doctor. So it's just the first step to enter into the medical field. And your second responsibility is to pass in your examinations with good marks, right? Hope you know the importance of learning anatomical structures and its relations, right? For example, in future, a patient come to you with a scan report which showing gallbladder stone or cholelithiasis, okay, or cholelithiasis. Then you must know the structure and relations of the gallbladder and extrahepatic biliary apparatus. You know that the gallbladder connected to liver, pancreas, and second part of duodenum, right? So if any block in the gallbladder, it may affect the proper functioning of all these related structures also. Without knowing all these basic relations, you can't be a successful practitioner. So that's the importance of learning basics of anatomy, right? Then we will come back to the study techniques. Before starting with this, one more point. You should remember one thing, that it's never late to start studying for your examinations. Still, you have enough time to score good marks if you study systematically and sincerely. Fine. Then the very basic problem facing by all the first year students is the memorizing the anatomical terms. There are around 8,000 anatomical terms to learn in order to understand the structure of the human body. In this, you have to know at least half of the terms to learn the basics of anatomy. Okay, so in the first year, at least you should know the half of that. Still, learning and memorizing all these terms in an year is not an easy task. Every student having some common and different issues while studying the anatomical structures. Some having issues with memorizing its dimensions, borders, surfaces, blood supply, nerve supply, etc. Right. So mostly there will be problem with artery supply, venous drainage. Right. When you are studying about one organ, for example, stomach or lungs, you will think that it's so easy to understand, and that day you will think I am perfect in that organ. And next day when you study about pancreas or spleen, that time also you feel the same, like I am perfect in these topics. But while memorizing the previous day topic, the real problem starts. You will mix up with the borders of pancreas with borders of stomach or spleen, or confusions in the artery supply, right? And when you complete study 5 to 10 organs, things are getting more complicated. Like It will be a complete mixture of body parts. For solving such issues, some charts will help you than paragraph notes. It's not late to do all these basic things. From today onwards, you can spend half an hour a day. You can easily finish it within a month. Okay. So here, some basic charts. Some basic charts like, about Mr. Lee Cruzen. Okay. So you can start with the list of organs present in each systems. Hope all of you know the mnemonic here, Mr. Lee Cruzen, of all the system wise, right? In that, make a chart of all organs in each systems in an order. Like here you can see, in an order you can see which and all organs are there. Then make a list of regional organs, like the organs present in the thorax, present in the abdomen, pelvis, and cranium. Like that, make an order of system wise and make an order of region wise. Then in case of abdominal organs, you know about 9 regions of the abdomen. Make a list of organs present in each quadrants. With this, you can write the introduction of any organs, like its parts, it's a part of which system, where it is located, or it is an abdominal organ, which quadrant of the abdomen it is located. Like that, you can write in the introduction. So this introduction is very, very important in exams, right? Because it's a first impression. Then from each system, make a chart of measurements. So you can make the measurements of this difficult, but some organs having almost same measurements, like some organs within 1 to 5 centimeters, some within 5-10 centimeters, and some in millimeters. Like that, a comparison will help you to remember the measurements. Okay, so that is better than studying individually. You make a list of organs having almost similar measurements. Then the external features and internal features. For that, best way is to draw and learn. Here, the other issue comes for most of the students, like I don't know to draw diagrams or I don't have drawing talent. Here, I want to say something that no one will judge your drawing talent. So, you're a doctor, you're going to be a doctor, no need of worrying about your drawing talent. It should be somewhat fine. Like you have to draw a neat diagram with label the major points. Okay, so that's enough. No need of worrying about your talent in that. Just convey your knowledge with diagrams. It should be somewhat looks like the organ. It should be neat and properly. This properly labeling will be there. Okay, so that's it. So draw diagrams, label each parts. So like that means you draw 3-4 times the same, like stomach, liver, one part with which and all the ligaments are there, borders, circles are there. Like that you can study. It's better than you're reading in the textbook and understanding one organ. Just draw that. Fine. Then you will come to the blood supply. That's another major issue while studying anatomy. The blood supply is very important for organs like in the exam, right? So there are so many branches and sub-branches of arteries and veins are present in the body. Even a small branches divide into sub-branches like anterior, posterior, superior, inferior. Okay, so there are so many branches and sub-branches. For some organs with 1 or 2 arteries supply, it will be easy for you to remember, like for the appendix, appendicular artery, for a thyroid artery, right? I don't think there will be much issue in such organs. But when it comes to the major organs like heart, liver, stomach, eye, ear, nose, right? So here the problem is having many branches and many sub-branches are supplying in that region, right? So here you should know the basic aorta and its branches, okay, and which and all region. It's like main branches, you can see it here, like external carotids, main branches. At least you should know that each facial, maxillary, where and all region it supplies. Okay, you have to make a chart of that. So you will get an idea about which main branch is supplying in that regions. And also here you can see the abdominal aorta, and you know about the gut, like foregut, midgut, and hindgut. Okay, the idea should be there on these regions, like from where to where celiac trunk is supplying. Okay, in the midgut it is superior. Okay, mesenteric. Like that, you should have an idea on the basic structure or the basic supply of the blood vessel arteries. Then it will be easy for you to write in the examinations. Fine. So next one, here you can see that it's better. I told like to make chart on each system-wise organs. You can start with the digestive system, with oral cavity. You can start with cheek, lips, and all. You can write one organ in the order. And next is artery supply, venous drainage, lymphatic. So you can make a chart like that. Okay, and you know that there will be interconnection of these arteries. Like the blood supply will be the same. Like example, the palate and the nasal cavity is having almost same artery supply, and also the tongue and the pharynx region. So like this, if you write like that, you will get an idea on each blood supply. Like, so no need of studying individually, you'll get an idea on this. Also you can add the nerve supply also, right? So next one about the nervous system. So in the nervous system is one other major issue for students. It is not a simple issue because it's really complicated one. And the truth is our brain itself is not enough to understand about the brain structure, right? If you start studying brain and spinal cord structures without knowing the introduction, okay, so you should know the before studying the structure of brain and spinal cord, you should know the histology of that. You should have the basic idea about the neurons, gray matter, white matter, nuclei, ganglion. First you study that properly. Then after that you study about the structure. Okay, like you should know about midbrain, pons, medulla, spinal cord. Everything you will understand once you know the histology of that. So you have to study in that order. And next, here you can see that you can, in your day-to-day life also, you can memorize that for at least till your exam. What you should do means you have to know that at least touching one part, like the back of the ear, the posterior auricular part is supplying by the facial, right? And also size of the helix. So you should know that while touching, you just memorize that is supplying by the sensation is going through the facial nerve, and in the concha region it is going through the vagus nerve, and the down part, that is the lower part, by the trigeminal nerve, right? So you should have just memorized like that one part. Okay, and you can discuss with the friends also, like one part. This the same way you can see that taste sensation. Okay, so you know the anterior two-third of the tongue is by the facial nerve, and the posterior. So when there is a bitter taste, the bitter taste comes along the maximum bitter taste buds are coming in case of circumvallate papillae, which is comes in the posterior one-third part, right? So that part is supplying by the ninth one, glossopharyngeal nerve. So when there is a bitter taste more, you should know that is passing through the glossopharyngeal. And other taste mainly is that is at the tip and margins of the tongue is passing through the facial nerve. So you should have such ideas. So you just memorize that. That will be useful for you till your lifelong. It will be useful. Okay, and also here same way the trigeminal. And here you know that I don't think you have much problems with the parasympathetic, because most of the structures from the pharynx, esophagus, up to the right two-third of the transverse colon by vagus nerve, right? So remaining down parts by the S2, S3, S4, pelvic splanchnic. Okay, but in case of sympathetic supply, you know, from the T1 to L2 spinal segments. So you should have a basic idea from which and all regions are supplying. Okay, from T1 to L2 spinal segments. Fine. So next one, how to approach the syllabus. Okay, here the issue is like all the students will get a panic attack after seeing all this full syllabus papers. So here you can study like this. You can take one topic like preservation of cadaver. Same thing is there in the Mridashira Samshodhana. Then Asti Sharira is the osteology. Okay, so in the exams also, if any question comes, you have to know at least you should be perfect in either one of this. So you can manage with the mark will you can manage some marks with the help of its Ayurvedic part or modern part. If it is asking about the osteology part, something you can write about the Astisharira. It's not like if you are not remembering that you can go with that. So you should have a basic idea with both that, like heart. I told about heart and all the organs having Ayurvedic reference also. You should have a basic idea on that. Okay, then you can manage and get some marks by that. Fine. And about important questions. So for examination, already Dr. Mulidas have told that, like we can't tell like that because one thing you can see the previous question paper, some questions will be there, they'll be repeatedly asking, but that is around 50 to 60 percentage will be repeating, and we can't exactly say that this won't ask. And you have to study everything because one patient come to you later, you can't say that I didn't study that, so I can't consult you like that. You can't tell like that. So you have to know about each and everything, right? And for exam purpose, you can refer your old question papers. For it will be repeated questions will be there. It will be useful for you, right? So by this, I am concluding my section, and you can post your queries in chat box. You can share. Okay, and thank you for the opportunity given. Hope it was helpful to everyone, and all the best for all students for your exams. Fine, thank you.
Thank you, Dr. Ranjit sir, for helping us as always to navigate our way through anatomy for our exams.
Now, moving on to the final session led by Dr. Manikrishnan K. Presently working as Assistant Professor in the Department of RACHANA SHAREERA, Sharada Ayurveda Medical College and Hospital, Talapadi, Mangalore. Sir has completed his BAMS education from Nangili Ayurveda Medical College, Kodamangalam, and PG in Rachana Sharira with University third rank from STM College of Ayurveda, Hassan.
He has also secured first rank in research methodology and statistics in first year of his MD, Rachana Sharira. He has published 5 research papers based on anatomy in UGC-approved research journals. Let's welcome Sir to take over the session. Over to you, Sir.
Thank you for the warm welcome. For myself, Dr. Manu Krishnan K. Very good afternoon to one and all. So let's begin with the session today. And I'll be focusing entirely on the presentation techniques. As our guest speakers, respected Dr. Murlidhar sir and Dr. Ranjit Warrior sir have spoke well about the different learning techniques and how to prepare for your exams and how you have to concentrate on a particular area so that you can just score well for the exams. There is actually a key part which we haven't addressed right now, that is the problems with the presentation skills. So I would like to present you 4 scenarios that you will commonly come across during your exams. So the first thing being the scenario number 1 and scenario number 2. So once you have completed the exams and once you get the papers, sometimes your friends will be saying, I have attempted all the questions, yet I didn't got the marks that I expected. Why is it like that? Or I have studied everything properly, but I'm not getting enough time to present it, and or I'm taking too much of time to plan it and write in the given set of sheets. These are the 2 common scenarios that you will be coming across in the exams. And the first thing and the foremost thing, you should know your enemy first. So who is the enemy here? That is nothing but your mistakes or the hurdles that you come across during the exams. So the major hurdles that you have come across in the exams are the bad writing pattern and the lack of presentation techniques, and the worst of them all, that is the handwriting. So it is a major nightmare for the people who have a bad handwriting, right? You will be always getting less marks even if you write everything that cannot be changed also. So how we can improvise it? So before going to that improvisation part, you should know what are the mistakes, right? So the first scenario, I repeat, I have attempted all the questions, yet I didn't get the marks that I expected. And the second one is I have studied everything properly, but it's taking too much time for me to plan everything and write it on the paper. In these both ways, you will lose the marks. And your flows lie in the presentation techniques and the skills. So, what is presentation techniques? The first thing, always you should have a plan. There should be a plan A and a plan B always. So the plan A is to prepare well for the exams, and the plan B is like when you are attending the exam. That time you may come across some stress, you will be scared of the questions, you will be reading the question paper, and you will end up getting scared. Like the first 10 questions will be easy for you, the remaining questions will be like a question mark. Like, I don't know them clearly, then what should I do? You will start thinking about the last questions that you don't know, and you will end up losing the first questions also. You won't be able to concentrate on writing well those questions, and you will end up losing marks. So the plan is always to upskill yourself by learning easy to apply answer templates. What do you mean by answer templates? When we teach you anatomy and when we teach you Rachana Sharira, Ayurveda points, always we'll give you a set of headings, right? We'll tell to give an introduction, then you have to write about the dimensions of the organ, then you have to write about the structure of the organ, then you have to write about the blood supply, then nerve supply, and finally the clinical anatomy. So these set of headings are nothing but the answer templates. So it's almost like a fill up the blanks. Once you have studied the set of organs, whenever you are getting a question related to an organ, you are supposed to give these headings first and then you have to fill it up. It's almost like fill up the blanks if you have studied the things properly. Okay, so upskilling the techniques to learn the answer templates, that is the first thing that you have to do. And the second thing is focus on highlighting the headings and subheadings. So it looks very simple for you, right? Only 2 points to improve the presentation techniques. But the fact is that these are the only techniques that you have to choose in order to score well for the exams. And one thing is understood, the plan is only applicable when you have the plan A set. And the plan A is nothing but the preparations well before the exams. So once you are prepared well for the exams, these plans will work out as the plan B when you are presenting on the paper. So these are the 2 points you have to focus on. And one more thing is very important, seeing your answer sheets from the examiner's point of view. So have you ever thought about the exams? Like in the examiner's perspective, most of the times what you do is you will write whatever you know and you present it and come out. You never think about how the examiner will be reading the paper and how they will be correcting it and how they will be putting the marks. So always the presentation is the key to impress the examiner as well as to score well for the exams. So that is an important point to remember, the examiner's point of view. Whenever you prepare and when you present in an answer sheet, always think from the eye of an examiner, and that is how you will score well. Okay, and so we will begin with our session where we will be discussing the mistakes first. So there is always a quote that is saying like, always you should learn from your mistakes. So I'll be just quoting some examples where you can find the common mistakes most of the students make in their answer sheets. So by seeing that, you can learn how not to do that and not to repeat it in your next answer sheet. So the first one here, I have quoted 2 examples here. These are 2 answers written in a very abrupt way, where you can see the first question was Sharira, and he have written the sloga properly, and right after that, he got confused. He just started writing one sloga. He thought like it is wrong. He have scribbled it down in a very bad way, like he have continuously scribbled over it, and he have written the very same sloga afterwards, but a little bit in a neat way. But the thing is like the impression will go by seeing this kind of presentation. And the alignment is also not proper. Always once you have the margin, when you are giving the subheadings, after the Sharira terminology, you have to give whether what you are writing as a sloka. So there should be a heading as the etymology or the introduction part. And the other concepts, then you can note down the other concepts of Sharira. and it should be in a proper order. And on the other hand, on the right side, you can see another presentation where this is actually the first page of a answer sheet. And you can see that the very first two sentences, you have crossed it down. You have neatly crossed it down. That is an advantage. But still, if you are not sure about the answer, don't start writing it. Now you get the answer sheets which is having prefixed question numbers. So you just go for the questions that you know properly and always begin in a good way. That will improve your confidence as well as your further answers will be much better. Once you answer the questions neatly for the first three questions, you will gain a confidence, and that will help you to improvise the further questions, or you will get some concepts once you cover those questions. And these are the not to be done things when it comes to the exam answer sheets. So here also you can see he have started writing something and he got confused. Again, everything was crossed down and even the written answers were wrong. And there is no proper diagram also. So that will end up in getting less number of marks. So this is one reason. And here you can see another sheet where you can see he have started writing something, he got confused. And again, it has been crisscrossed in a very bad manner. And then again, the same has been repeated again with a number of flowcharts. The concepts are clear, even the handwriting is legible, but the presentation is poor. So that gives a bad impression over the examiner, and that will cut short in your exam marks. And the next one here, this is another common mistake. Now it's the era of messaging, right? So everybody try to cut short the words. They will use abbreviations for explaining a particular word. Here you can see it is the explanation for the rectus sheet. And he have written everything in a proper way. The handwriting, you can see it's not legible. So that is a disadvantage. Along with that, while presenting, you can see that the labeling of the diagrams, he have used notations like E oblique, I oblique, and T oblique. What are these? You can't use an abbreviation when it comes to the exams. Whenever you are labeling something, you have to write the complete names. So here it should have been external oblique, internal oblique, and transverse abdominis. It is understood, but if you write abbreviations like this, that gives a bad impression. And maybe a problem would have occurred, like he would have left behind the answer to draw the diagrams later. And when you start drawing the diagrams at the last moment, you will end up getting no time to complete all the terminologies and you will end up writing the abbreviations instead. So that should not happen when you are presenting on an answer sheet. So this is also a big no. You are not supposed to do it. And here we have another answer sheet where there is on the left side, you can see the trachea has been explained with all the proper headings, the location, then the dimensions has been explained, then all the necessary explanations are there, but it all got wasted by this diagram. So the diagram which you have drawn here, or the diagram that you can see here, it is not at all like in par with the actual diagram of trachea. So that gives a wrong impression, right? He doesn't have learned properly, or maybe like the examiner might be seeing the paper fast. That time, if a wrong diagram is there, we won't even try to read all the points later. And after seeing this, automatically the mark will be cut short to half of it. And that will give a lesser score when you are expecting good marks out of it. So if you are not drawing the diagram, do repeatedly draw and learn it, and don't draw the absurd diagrams. Even if you might skip the diagram also, it won't be that harmful. But always the diagram has a weightage when it comes to anatomy paper. So always practice the diagrams. And here in the case of chorda equina, all the necessary points are there for a 3-mark question. But at last, it got wasted by a wrong diagram. So it doesn't at all look at like a proper chorda equina, and it looks absurd, and that gives a bad impression, and you will lose the marks. So this is also a big no. Always try to draw and learn, as Ranjit sir have told previously. Draw repeatedly and learn. It's a tough process. Many of you won't be good at drawing these diagrams, but you can make simple diagrams or sensible diagrams that will do the job. Okay. And here is another example. Here you can see the complete answer of the peritoneum. The person have written everything neatly, but the problem is it looks just like a textbook. All the details are there in a paragraph form, and the examiner has to struggle to find out the points whether to give the marks or not. So this is also a wrong thing to do. You are not supposed to buy heart the things. Instead, you learn the things, understand it, and try to present it with flowcharts and tables. You have tried to incorporate some flowcharts, but still the writing is too much, and the sentences, if you add up the sentences, the readability decreases. That is the easiest way I can explain it. The difficulty to read through all the sentences will be more, and that will end up giving you less marks than you have expected. Then here another example where you can see it's about Mrida Samshodhana Vidhi, but the person have written Mritu Samshodhana Vidhi and he is not good at writing the slokas. You can clearly see that there are no slokas incorporated into it. See, it's quite possible that you can forget the slokas during the exam times. But if you are not forgetting, like remembering the complete sloka, at least try to recollect the words that have been told in the sloka and quote them and explain them. Rather than writing only the translation, you can use some words that are taken from the sloka, write it in the Sanskrit, and then start explaining it in a flowchart way. So I'm telling you all the mistakes right now, and after this, we will discuss about the makeover tools, how to get through these hurdles, and how to learn to overcome these hurdles. So the first thing is easy to read writing style. So when you are writing an exam, you should be always focused on making it easy to read for the examiner, and always incorporate flow charts and tables and diagrams so that it will be more easier to convey the amount of knowledge that you have to the examiner, and it will save a lot of time. So whenever there is less time, you have to stick on to the flow charts and tables instead of writing the sentences. When you have to write a sentence, it takes half the time of that to make a flow chart or tables. So I'm giving you some examples here. So we have seen the answering pattern of the trachea before. So in the same way, the complete explanation has been given here with an introduction, location, dimensions, extent, the diagram. The diagram is not included, that you can refer from the textbook. This is a typical answer template that you can use in your exams. So here you can see the structure has been explained not in sentences. Instead, it has been explained in a flowchart way. And when you read through this particular part of the paper, you will get to focus on this bubbles, right? So the bubbling is another way to highlight the contents what you have written. So here the fibroelastic wall, it is C-shaped rings. C-shaped rings, they are 60 to 20 in number. Fibroelastic membrane is in between them. And the trachealis muscle is there. So only the focus points will be noted down by the examiner, and that gives a good impression, and always it will be easy for the examiner to read it, and that is an easy advantage for you to score well for the exams. Here there is a similar example of the thyroid gland where we have given the same headings, and here you can see the dimensions and all, only the necessary points are written, and the structure also written in a flowchart way. So this is the easy pattern in which you are supposed to write, and this is how what helps you to score well for the exams. And here is another example for the axillary artery, where you can see there is hardly 2 or 3 sentences written completely. Other than that, everything is in the flowchart form. This will save you immense amount of time. See, like when it comes to the exams, the time management is very important, and we will be focusing on that in a few slides ahead, and I will tell you how to manage the time properly. So this kind of presentation where you have to use the flowcharts and diagrams are very important, because that will save you a lot of time, and that will give you extra marks as well. So this is another pattern in which you can write the answers. And here the same question, the Mrida Samshodhana Vidhi, has been classified into a set of headings. There is an introduction about where it has been told. Then there is the importance of dissection. The sloka has been quoted down. And if you forget the sloka, only take the portions of it. Tasmad nisamshayam jnanam hartra shalyasya vachata shodayitva mridam samyak drishtabhyo anga vinishya. That can be splitted up into different compartments, and you can take a part out of it and explain it. that will also do the job. But still, always try to by heart the slokas and try to just recollect it. And if at all you are forgetting, you can try for the plan B, that is splitting up the sloka and writing the parts of it. And here you can see the selection criteria of the cadaver has been splitted up into single words. Samastagatram, Avishobhagatam, Adirga Vyadipeditam, Avarshashatikam, Nisrishtandra Purisham. And you can give the exact translation for each of these words. That will also do the job instead of writing the complete sloka. And always quote the reference when you are writing down a sloka. And here I have used the flowchart method to explain the process of Kodana, where the wrapping of the body with the Munjavalkala, etc., and the procedure for dissection, everything has been cut short. Everything has been done in a flowchart manner. And here, another thing that is the use of tables and charts. So here I have given example of marma. So it's a repeated question that explain the classification of marma and explain the marmas, Jatrudagada marmas, or any particular set of marma, maybe Satyapranahara marma, maybe like Vishalyakna marma. In that case, what you are supposed to do is, instead of writing one single marma and starting the fivefold classification as the Pramana Vedena, Rajana Vedena, Parinama Vedena, like that, if you start writing for individual marmas, it will take a lot of time to explain it. So why can't you use a table? If a table is given, all the headings will be done in the first row itself. Then you have to just note down all the points below it, and that will be more legible for the examiner to correct, and that will give you good marks because of the presentation. So that is an important point to remember. And here we have the clear explanation of the rectus sheet, where it has been well presented with a neat diagram and the minimal sentences and the flowcharts. So this is an example of good presentation where you have to concentrate on both the diagram as well as the content. And here every details are there, and this is how you have to present. And here you can see all the labelings has been done completely. Not any abbreviations are used here. Everything is written completely. So that is an important fact to remember. And here the trachea. And here I've kept this paper particularly because you can see that one diagram has got wrong. Once the person have started drawing the diagram, he felt that the diagram is wrong. And what he have done is he have scored very neatly over it and have drawn the proper diagram below it. This is a proper way to make a correction. You are not supposed to scribble down over it over and over, making it look messy. Instead, you have crossed it. That means that the diagram is wrong, and you have drawn the proper diagram below it. That gives a good impression only. You don't have to worry about the crossed up diagram because nobody is going to check up a crossed diagram. Instead, you have drawn the diagram properly. So this is the way you have to make a correction in your paper. And the peritoneum here, you can see the different, how the answer has been written with proper flow charts and tables. Instead of writing sentences explaining the parietal peritoneum and visceral peritoneum, they have used the table format so that all the points are there, yet it is very easily accessible. So that makes the work easier for the examiner, and that will give you more marks. And the diagram is also very neatly written at the last with the clinical anatomy involved. So this is a proper way of presentation. Okay. And here the 3-mark questions, you can see a small diagram. Always it is a doubtful thing. Like for 3-mark question, we have to fill only one page. Then why should I draw the diagram? So that is a common question the students will ask. The thing is that the diagrams are an integral part of the answering when it comes to Rachana Sharira. You are supposed to explain the structures with the diagram. That gives an easy conveyance, and that is very mandatory that you have to draw the diagrams. So for example, the portal vein has been asked for 3 marks. A simple diagram with a short explanation, as our dear sir, Murlidhar sir, have told clearly that 6 points only have to be written under the 3-mark questions. That is very sensible. Here you can see that there is only 6 or less points, but there is an added diagram also that gives an advantage over the other answer sheets. Here also you can see the coda equina, where you have given the explanations in short and included a small diagram to represent the same. So that concludes that you can get full marks out of it. The 3-mark questions always you can score full out of it. So just make it perfect and get the maximum score. And the scenario number 3. I knew all the answers, but I couldn't attempt all the questions since there was no time. That is a common problem that you'll face during the exams. There is no such thing like there is no time to attempt all questions. So what might be the problem? I'm getting confused on framing the answer, or more clearly speaking, I don't know which part to be included or excluded under an answer. So always you will be thinking what points I have to include in a 10-mark question, what points I have to include in a 5-mark question, and that will eat away the complete part of time that you are supposed to write the exam. You will be thinking about the structuring of the answer and you will end up losing so much of time. And it takes a lot of time for me to think before I answer a question. So this thought process is happening because you don't have a fixed answer template. So always you should have a fixed answer template for the set of questions. Say for example, for organs, one set of answer template. For arteries and veins, a set of answer templates. For nerves and muscles, a separate set of answer templates. That has been clearly discussed on the previous session of STEP webinar that we have conducted on the previous year on 2021. So you can refer to it. We have it in the playlist. So if you refer to that, you will get the complete list of answer templates on each of this type of questions that you can refer later. Then the time management. So if you don't break down the time properly for individual questions, you will end up losing a lot of marks. So what do we have in hand for an exam? University exam, we have 3 hours in hand, which is 180 minutes in total. So the actual time in hand is 170 minutes. We have to take 10 minutes as an extra time to make the corrections and necessary corrections in the answers that you have written. So there is a typical way of dividing the time for each individual questions. So the first thing is the long essays. When you have the long essays, don't spend more than 25 minutes for a single essay. Always stick on to this timing that we have to finish off at any cost at this particular timing. So the first long essay should finish at 25 minutes. The second one will continue and totally you will lose 50 minutes out of the 3-hour time. And later you have 10 short essays. And in that 10 short essays, for a 5-mark question, the maximum time you can allot is 8 minutes each. You should never cross it. And if you cross it, it will be taking the time from the another question that you have to answer. So you will end up getting lesser time by just delaying each questions. And finally, you will end up losing 10 or 15 minutes. That is a crucial time. Okay. So the last one is the short answers. For the short answers, for covering one page, the maximum time you can utilize is 2 to 3 minutes. So that will take up to almost 30 minutes from your exam time. So in total, you have spent almost 170 minutes and you have 10 minutes in hand. That is where you have to go back and verify that you have written all the questions properly. And if you are not sticking on to this particular pattern, the problems are the following. So you are at the last half an hour of the exam. You have 30 minutes ahead of you, and you almost have 10 questions to finish. What will be your situation? You will start panicking. Once you start panicking, you will get stressed out, and you will get that feeling of complete blank memory. You won't be able to remember anything. You will start sweating, and you will think about how to finish off all the questions. What will be the end result? You will not be able to memorize anything, and you will be leaving some questions behind. Some people will do that. They will go blank and they will leave the questions behind. And for some people, it is different. They will try to attempt all that is left behind. So what will be the end result? Once they start attempting all the questions in just 30 minutes, the result will be that they will be writing all the questions incompletely. That will cost a lot of marks. So that will be the problem that you will be facing if you don't manage the time properly. So what should be your focus? You should always stick on to the pattern that we have discussed over, like 180 minutes. It should be cut short. For the 10 marks or the long essays, you have to spend up to 25 minutes maximum. And for the 5-mark questions, always for the short essays, you have to stick on to the 8-minute cutoff time. And for the short answers, you have to stick on to 2 to 3 minutes time. So that will be the ideal timing that you can spend for each question. And if you do accordingly, you can always reach the proper place in the score sheet. So that is how you have to step forward and focus on your presentations techniques in order to score well for your upcoming exams. So I'm wishing all of you good luck for your upcoming exams. And I take this opportunity to thank the dear management for providing us the platform to do this webinar. And I thank our beloved principal, Dr. Ravi Ganesh Mogra sir, for giving all the support and guidance. And I sincerely thank the technical team who have been always been the part of this program, and they have been helping us a lot. I thank them personally, and I thank all my colleagues for the support. Thank you. Thank you, one and all.
Thank you, Dr. Mansa, for sharing your sincere insight on how to present and approach anatomy exam in a smart and organized way.
Finally, I would like to thank our speakers for being here with us today and enlightening us with their knowledge.
It also gave insight into the topic and revealed some interesting facts. Hereby, we are announcing the release of the question bank on the subject RACHANA SHAREERA, which would be available to be downloaded from our website www.samch.co.in/step. Link will be shared with all registered participants shortly.
Thank you once again to all the speakers and viewers for joining us today. Thank you.